Hi, thank you for watching this segment of Envision and Achieve Your Best. I'm Dr. Dina Churchill, innovator of women's health and wellness, international speaker, author, chiropractor, health coach, and internet radio show host. And my purpose is to gather what I've learned and to share it with you to help improve your fitness, your energy, and your health and vitality. I'm going to start with chiropractic because it's the basic foundation of where I come from and what I believe. In that your nervous system, your brain and your spinal cord controls every cell, every muscle, every tissue, every organ system in your body. In fact, an embryo's nervous system is the first tissue to differentiate. It's the nervous system, 7 hours after conception, that controls the differentiation of all the other tissues. So even if I wasn't a chiropractor, the nervous system would be mandatory. So I'm going to give you a quick anatomy lesson on chiropractic and what we do. So chiropractors are doctors given the ability to diagnose. We're not medical doctors, we're doctors of chiropractic. So we're not treating cancers or kidney infections, but we're expected to differentially diagnose those conditions from low back pain, for example. Chiropractors are like mechanics to your spine, improving motion to optimize function of your nervous system. So if we take a quick anatomy trip out here, this is a spine. If we take off your clothes and your skin and your muscle, will be a line of bones. And this vertebral column, the purpose is to protect your spinal cord, just like your skull is to protect your brain. And in between these bones, these are called vertebrae, there's a disc, and the disc is like a jelly donut to give shock absorbing quality, but also to act as a spacer for this nerve, the spinal nerve that comes right off the spinal cord. And in between each of these bones, there's a facet joint, and that joint is responsible for movement. You'll also see how it can affect that nerve root, that spinal nerve root. So chiropractors optimize function of that mechanical part, again, to improve the nervous system. Now you can see there's some curves in this spine. There's an inwards curve in your neck, there's sort of an outwards curve in between your shoulder blade, and an inwards curve in your lower back, so your spine kind of looks like that. And those curves are like coils in a spring. They help dissipate the forces equally over your spine as you're moving. So chiropractors perform a high velocity, quick, low amplitude, shallow, thrust or push into the segments to restore motion. And again, that optimizes function of the nervous system. And we talked about the nervous system being the master control system, so you can imagine how important that is. And now, who do we perform adjustments on? Well, my youngest patient is about 3 hours old, and my oldest patient is 89 with all sorts of conditions and different body types in between. Chiropractic is about optimizing wellness. It's not just about taking pain away. So my advice is that everybody needs a chiropractic checkup. Maybe different people require different methods of care, different types of care, or maybe chiropractic's not even appropriate for you at this time and you need something else in the meantime. But how do you know? You know, and people say, oh, what do a child need to go to a chiropractor for? Well, birth, even natural birthing methods, can be so stressful for that little spine. And that first year of life is when that neurological development happens at a massive rate. So you want to start your children, your babies off with a good start, and part of that, I feel, is to have a wellness check with a chiropractor. So chiropractors, being doctors, given the ability to diagnose, we treat, like mechanics, joint function, optimizing joint function, which improves nervous system function. And again, that nervous system, being the master control system of your body, improves your health and vitality, even of your cells. So it's a fundamental part of your health and wellness. And chiropractors, what else do I want to tell you about chiropractic? Well, once you see your chiropractor, you can set up a treatment plan or a schedule, and you'll determine what's best for you. So medical doctors would look at, we'd have the same training as far as a diagnosis, radiology, lab diagnosis, but medical doctors would branch out into sort of pharmaceuticals and surgery, where chiropractors look at diet structure and nutrition in a different way of improving your health and vitality. So what tip can I give you? Let me say, when a patient comes into my office, I always start off by saying, you know, your health and our journey is really a teamwork approach. That 50% of your recovery is what you're going to do at home. And we do this brief postural exercise that is, again, important, fundamental for your health and vitality. So find a wall. Line up against the wall. Your heels are against the wall. Belly's tight. Your shoulders are rolled back, and that engages your rotator cuff muscles. So how you can do that is turn your palms out. So instead of having your palms facing in against the wall, face your palms out. Imagine that you're tightening between your shoulder blades like you're trying to catch something between the bottom of your shoulder blades. You're going to bring your chin in, keep your chin down, almost like to create a double chin. I know you ladies will love that part. And then you're going to hold your eyes level with the horizon, just like you're trying to rest a book on your shoulders. Now, someone who's really kyphotic or leaning forward will find difficulty in bringing their head back right now. That's fine. You can work on that. We're going to ask you to hold that posture for about a minute a day. But for now, we just want you to come into the posture as best you can, close as you can get it, and hold it again for a minute a day. That helps reprogram your proprioceptive nerves. It also helps stimulate those postural muscles that keep you upright. Now, if we look at the nervous system as one piece of flesh, let's say this electrode is your brain and the long cord is your spinal cord, you can see that if something's pulling in your neck, it can affect your lower back, and something's pulling in your lower back, it can affect your neck. So if we maintain those curves that we talked about in our spine, there's some slack in the nervous system. If our head comes forward, for example, we're putting tension in that nervous system. Not only tension in the nervous system, but tension in the muscles. So if you have a bowling ball, for example, which is about the same weight as your head, 10 pounds, and you hold it out from your structure, this muscle will quickly fatigue. If you put that bowling ball back over your shoulder, you'll be able to hold it for a longer period of time. So posture, again, is essential tip for health and vitality. These nerves, too, from your neck, all the nerves supply your eye, your ears, your nose, your sinus. Like the nerves from your lower back supply the organs in that area. So that would be your bowels, your bladder. So what some patients will note as we start improving the health of their nervous system is other improvements, like their bowel function improves, or their ileitis or colitis symptoms reduce, or their heartburn improves. Not that we're directing our treatment towards those symptoms, because we treat really where we feel the mechanical dysfunction, improving the nervous system. But when the nervous system's healthy, you're healthy. So I'd love to just thank you for listening to this episode of Envision and Achieve Your Best. There will be a series that I'll send out over the next few months, so I hope you enjoy them. I'll ask you to reach for the stars, envision and achieve your personal best. And most of all, enjoy the journey. This is Dr. Dina Churchill, signing out.